that is Ceren EK? EK? AJ. Ceren AJ SEMIZ. So this topic is residual refraction correction after LASIK by adjusting corneal Q value with SMILE module. Okay. You can start.
Okay. Residual refraction after LASIK is a common cause of postoperative patient dissatisfaction. And in our study, our purpose was to investigate long-term efficacy, safety, and corneal changes after fresh lenticle transplantation to treat post-LASIK hyperopic residual refraction. So why did we prefer this procedure? Because it preserves accommodation and it's reversible. The lenticle can always be explanted when needed. And also it's ideal for patients who do not have cataracts. In this retrospective study, we included 64 eyes of 32 patients, 18 male and 14 female, and all patients were followed for at least 1 year. And the study was approved by the National Research Ethics Committee of the Ministry of Health of Kosovo. And our inclusion criteria were that patients were at least 18 years old and they had already undergone LASIK surgery and had residual hyperopic refraction. And their pre-op corrected distance visual acuity was at least of 0.5 logmar, and they were willing to undergo this procedure. And the exclusion criteria was the presence of any active infection, history of glaucoma, retinal detachment, and if the estimated postoperative corneal thickness after the surgery exceeded 650 microns, we excluded these patients from the surgery as well. Our patients were aged between 38 to 55 years. And their hyperopic residual refraction was between 0.75 to 2.75 dioptries, and the donor patients were aged between 20 to 28 with lenticle thicknesses ranging from 25 to 70 microns with dioptries between minus 1.25 to minus 3.5, and with optical zone between, in average, 660 microns. And when we were matching recipient corneas with donor lenticles, we paid attention to the mesopic pupil size of the recipient patients, and the transplanted lenticles were calibrated to exceed the diameter of the mesopic pupil size by at least 0.5 millimeters to avoid any possible problems at night vision. And in this surgery, we did not touch the flap. We made an incision at the depth of 140 microns instead. And our postoperative refractive target was minus 0.5 dioptries in this surgery. And the lenticle was transplanted centrally. And this is a pre-op and a post of 1 year of CT. And the uncorrected distance visual acuity, corneal thickness, K values, and RMS values increased postoperatively, and the Q value decreased postoperatively from negative 0.38 to negative 0.70, and the uncorrected near visual acuity at 80 centimeters improved from JAGA 6 to JAGA 3, and at 40 centimeter improved from JAGA 7 to JAGA 2 postoperatively. And the surgical technique alters corneal geometry by modulating the Q value, thereby enhancing corneal asphericity and improving visual acuity at far, intermediate, and near distances. And this could be a possible alternative treatment in the future, but such studies are needed to back up our results. Thank you.
Thank you so much. It is a very interesting series of cases post-LASIK hyperopia. And you did a smile in these cases and a hyperopic smile in these cases to take out the lenticule from there. Mm-hmm. Was there any difficulty because you already had a LASIK flap? Yeah. And how did you create the this lenticule? What are the depth? Because you had to, you can't take out from the flap. What was the flap thickness in these cases?
The flap thickness was at 110 microns, and that's why we make the incision at 140 microns underneath the flap.
Okay. So you had a deeper initiation. Were there these were femtosecond laser flaps or microkeratome flaps initially, LASIK?
Could you please repeat?
The LASIK procedure they have undergone,
Yes.
was it with the femtosecond laser or was it because, due to the microkeratome? You can make a flap by microkeratome also, you can make a flap with the femtosecond also. So these are femtosecond flaps or microkeratome flaps?
We made an intrastromal pocket
No,
instead.
no. Before you made an intrastromal pocket, the previous surgery.
The previous surgery was not done in our center.
Okay, they are all referred cases.
Yeah.
So
We don't
you
have
can have, if it is a microkeratome flap, then it will be thicker, then you have a very little stroma left to create the lenticule. But results are quite good in these cases. Okay. No difficulty you face, no complications?
No, in this series, no.
Okay. Any one question from the audience? Okay, thank you so much.